In honoring Dr. Sheth this evening, we are not merely recognizing a distinguished medical career, we are celebrating a lifetime devoted to compassion, learning, service, and the betterment of humanity. Ladies and gentlemen, please join me in welcoming the guest of honor for this evening, Dr. Ashit Sheth.
Ladies and gentlemen, I'll give a short introduction of me taking up psychiatry and why I made this particular documentary. When I finished my MBBS, I came to Bombay and then I declared that I want to take up psychiatry. The whole family, a big family, revolted and said, "The pagla doctor hai." And my uncle, who was the superintendent of Nanavati Hospital, told me, "Ashit, come here." And he was a little concerned. And he cautiously said, "Just think twice before you take up a psychiatry." I said, "Why, sir?" He said that psychiatry is a branch of medicine where the cause is unknown. Diagnosis lingers in uncertainty, and all the treatments are empirical. This was the impression which was carried by the medical people about psychiatry. Then he whispered in my ears, "See, I know many psychiatrists in Bombay. And many a times it is very difficult to differentiate between patients and doctors." So now I knew that what am I going into, because Kazan Takis, the famous author who got a Nobel Prize, said that if you want to be happy, you have to be little mad. And this is my profession which I want into. So then what happened was, what was the psychiatry at that time? It was an unknown continent lying in a thick fog. Our treatments were definitely empirical. Before that, incidentally, it so happened that my wife, Rekha, who came into my life, also came from a minor branch, and everybody kept on saying that both your branches, psychiatry and dermatology, is such branches where nobody dies, nobody gets better, and you have got a lifetime commitment with the patient. Anyway, I must say that she very patiently tolerated me. In my eccentricity and madness, very patiently she tolerated me. She went ahead of me and academically became brilliant and established a cosmetic dermatology, and that light which she lit on cosmetic dermatology is now being carried over by my children, and they are looking after her clinic very well, successfully. It was unfortunate that we lost her 6 years back to pancreatic cancer. I joined KM Hospital as a student. Excellent teachers I had, wonderful training I had. And I'm indebted to these particular teachers who devoted hours together teaching us psychiatry, which was a vague subject. And I remember Dr. Dungaji telling us that psychiatry is a vague subject and you have to be very definite. At that time, Dr. Dungaji retired and I retired, and we worked together. We produced 4 audiovisuals. That was the science, sound, and slide shows. One on pain was presented as a curtain raiser at an international conference of pain in New Delhi, and we got a standing ovation. This was an elementary, very, very attempt on our side to present something. These were the pain people who were discovering analgesics. And what do we teach about pain? So we went into sadism, masochism, loss of my child. Anish acted as a person who had no pain, his absence of pain, and we put him in all plasters because they keep on hurting themselves. So as I said, when I entered into psychiatry, it was a continent completely in thick fog. Things have changed. Things have changed to the level where various imaging CAT scans, MRIs, functional MRIs, PET scans have made this landscape of brain a little brighter. They've illuminated what is causing mental illness, and we know that major mental illness is associated with the brain problem. But still, we are in infancy. It is said that in 1930s and 40s, up to 1970s, we were hanging into mindful but brainless psychiatry. The Freudian era, which had established that a talking therapy was the only therapy. Today's medication has done wonders, and now today we are in the situation where I can say it's a brainful, mindful psychiatry. We have come a long way, but let me tell you that mental illness is one of the toughest illnesses in medical profession. The cause of this illness is psychological. No, there are biological causes and sociological causes. Every mind is getting influenced by the sociological factors. And we have a person who is a very strict father will create a problem. I used to joke around and say, when I see anybody beating a child on the road, I say, there's one more patient for me. But now we are understanding what is causing this cause, the trauma and the effect of trauma. But still, in spite of all the investigations, psychiatry has remained a clinical. Our weapon is to establish a good doctor-patient relationship and get all the available information from the patient and the relatives. But despite all, the statistics shows 80 to 85% patients in India who are seriously mentally ill do not get adequate care. There are 2 stigmas a patient feels. His personal stigma of getting a label of a psychiatric illness and the social pride and prejudices which influences this patient severely. लोग क्या कहेंगे? हमारे घर में एक पगला है, वो क्या कहेंगे? On that pretext, many of the illnesses are not treated. Many patients are not brought, or treatments are delayed when the patient becomes violent. But let me tell you, majority of the mental patients are not violent. They're suffering in silence. They don't have the language and they don't have the acceptance. The social fear is also very strong. And there is another type of fear and another stigma when persons suffering from severe anxiety and depressions are told, you should ignore all this. थोड़ा तुम 40 हनुमान 40 लिखो ना, सब ठीक हो जाएगा. पूजा पाठ करो, योगा करो, एक्सरसाइज करो, तो तबीयत अच्छा बनेगा ना. But some stigmas are cultural. I have kept a big waiting room because every patient is accompanied by 4 or 5 relatives. I get a lot of patients from Madhya Pradesh and Uttar Pradesh and all that, and every patient is accompanied by 4 or 5 relatives. 2 are genuinely concerned person, but the rest of them come to see the spectator. And among them is one eldest person who has a repertoire of advice through his experience. And what is the advice? A person is unmarried, uski shadi kar do na. A couple is fighting very badly, अरे बच्चा होगा ना तो सब सेटल हो जाएगा. And another stigma today in a modern age in the media, every prescription is scrutinized by Google, ChatGPT, Gemini AI, friends, relatives, sent it over to the astrologers and approved that yes, I can take this treatment. No. All the side effect lists is brought to me and a lot of fear. Ye mere ko hoga, wo mere ko hoga, wo mere ko hoga. Now we have to manage these patients. The only thing what we have at our disposal is doctor-patient relationship. Also, let me tell you, these medicines have been so useful that we have been able to treat majority of the patients at home without hospitalization, and also avoid unnecessary investigations because somatic manifestations of mental illness is very, very common. I have drifted various paths. I've been analyzed, psychoanalyzed. I've joined the behavior therapy. I know hypnosis. I have indulged myself in philosophy, mentalizing therapy, but my pet subject has remained psychopharmacology. After 50 years also, I still feel ignorant. Every patient offers me an enigma, which testus also can't fulfill. Everybody is a puzzle which I have to solve. Somebody asked me, why do you make a video documentary on music? Let me tell you, as a curious person, I thought why music is so powerful in our society. We are born listening to lullabies and people die listening to bhajans. The music is a denominator, a companion. And imagine a society without a music. Can you ever imagine a society, it has a new music, then it is not a society? Music binds people together. Music has a strong binding capacity. It secretes oxytocin, which we'll see a little bit in our documentary. But the most important part, it's a psychobiological phenomena, because if the society sticks together, they can share the skills, they can share the knowledge, they can transmit the knowledge further into society, so society prospers and becomes richer. That's why the music fascinated me. And where do you understand the music? The music you understand in that 1.5 kilo of that pulpy thing which is lying between your ears, the brain. That's why brain makes music.